These are the reasons why you're having reoccurrent infection. Mind you, I did not say reoccurrent yeast infection. I said reoccurrent infection. It might be yeast, it might be sexually transmitted infection. So both guys and women, men and women, should be interested in this video. Please listen attentively, because this question has been rolling. I've been treating infection, and I've taken all kinds of drugs, but it's not working. Please listen attentively. Number one, please, for ladies, after treating infection, or when you're about to start treating infection, or during the course of your infection, you see those your panties, try to sterilize them. Okay, you can soak them, sterilize them by putting them in hot water, putting Dettol in them and all of those things. Then sun dry them. If you have iron, beautiful. If you have money to change it. I will tell you the reason. I know you must have heard this, but it might not really be what you heard. It wasn't explained to you very well, so I'm going to explain to you very well. Okay, even men too, you have to sterilize your undies. This is because your discharge, okay, in your panties or your undies, when you're treating infection, those discharge, they are microorganisms. There are some microorganisms that will not go away with soap, just soap or just water. They need an extra agent, okay, disinfectant or sterilization with hot water or something else to kill them. They are pore forming microorganisms that will not go, okay. So after treating yourself and then you still wear these panties again, you will get reinfected. It's a fact. You will get infected, especially if you don't have a high immune system, which I will tell you how to build so that you will not have recurrent yeast infection, recurrent infection, both STI and yeast infection, because this is going to be a long video. Number two, please, if you have urinary tract infection that is recurring, try to reduce sugar. Apart from urinary tract infection, even yeast infection, reduce sugar. Sugar thrives, yeast infection thrives where there is excess sugar. This will help you a lot. The next one is, as you're treating yourself, please make sure you're treating your partners, okay? Don't, even if your now men do not really have signs. It's only women that is outward reflection. They always have signs. Even if their infection is like 2%, they will have signs. Why men will have like 20% and there will be no signs? They will feel they are okay. Actually, they may not be okay. They are the ones that, probably gave you that infection. I'm not saying, but they don't show sign. You are the woman. You will mostly show the first sign. So they will think that they are not infected. Okay, so this is very tricky. This is also called contact tracing. If you're treating infection, whether your partner feels they are infected or not, it is so. Whether they feel they are infected or they are not infected, it is very important that they treat themselves. Yes. So let your partner treat themselves. As you're treating yourself, let them also treat themselves. Take them to whatever doctor you're going to, lab you're going to. They also have to be tested, because it's not all the time that the signs and symptoms will manifest. So this brings me to our men. Please make sure you check. Always go for check whether you are having symptoms or not, because your body, the men's body, can hide infection so long that before it starts showing up, it might be already late. It might have damaged something or caused scar, or even cause you to have low sperm count or have sperm issues, okay, or erection issues, okay. So that's why most men, they don't really have symptoms. What they now see that they can't, stand up, they can't erect. That was now when they will go to the hospital and find out that they are having a sexually transmitted infection that has, been long. So the next one is, I know I talk too much. Sorry about that. The next one is, please, when you notice you have an infection, do not go to the pharmacy. I am sorry. Don't go to the pharmacy when you notice that you have an infection or something is going on with you. And that will lead me to signs that you may be having an infection. When you notice that you have an infection, all you need to do is to go to before that, please, let's go to signs that you may be having an infection, so that from there we can continue the other things, treatment and all the other things. So, signs that you may be having an infection. Number one, you're itching. Down there is seriously itching you. Number 2, you're having discharge that are purulent, smelling. Okay. Number 3, when you urinate, sometimes your urine is usually smelly. Number 4, when you go to the toilet, sometimes you might not even stay. You go to the toilet and your peeing is very painful and it hurts. The next one is sometimes your urine smells. Sometimes you have fever, serious fever. Sometimes, especially for women, sex is painful, serious pain. It might not be now, but later it will be painful. The next one is bleeding after sex for women. This is usually with the pains. It's usually a sign of PID, pelvic inflammatory disease, which I have a video on my YouTube page. Okay, for the men also, having erection is very hard. You will have itches around your skin. Your penis will be sweating you, like some itching. It will be itching you and sweating you kind of. You find it difficult to urinate frequently. Your urine will be cut, like stream. Your urine is cut. Instead of flowing well, you will say that it's cut. It's cut short. So your urine stream is not so, it doesn't flow well. It cuts short, okay? And again, you may have dribbling urine. Your urine will just be coming, it's dribbling. Sometimes before you could get to the bathroom, you've peed, and you will have this urgency to urinate. It's as if your bladder is full. Only getting to the urine, you say that it's just small urine that you urinate, okay? Or also you have, I've mentioned painful urination, and then you have burning sensation, okay? You just say it's as if there's stone, and urinating is hard, it's painful. These are signs that you're having infection. Now, this may be sexually transmitted infection or ordinary yeast infection or urinary tract infection. Remember, urinary tract infection and yeast infection are not sexually transmitted infection. However, these things will just be seen if you only go to a laboratory, or you go to see a doctor, or you go to the hospital. Very easy than going to the lab, than going to different labs. They will be giving you things that are not healthy for you. They'll be mixing things for you. That even if they give you, the infection will still come back because it might not really tackle the infection very well, okay? So when you go to the lab, let's get to the cause of how to treat infection, and so that it doesn't keep reoccurring. So when you get to the lab or you go to a doctor, they will just run a test for you. With the tests, they will now find out the microorganisms that is causing this, then give you a diagnosis of what you're having, and then give you an antibiotics that will finish that will treat the illness you're having. Now the problem is when they give you these antibiotics, make sure you treat your partner like I said, your towel, sanitize them, and all of those things. When you finish the antibiotics, don't stop. Please go back to the doctor, go back to them and rerun the test again to make sure that the infection has cleared, and also to make sure that your partner is free. When they are free, then you can now continue your life. And please make sure you stop sexual activities. Okay, if you're having infection, you're treating infection, you have to stop sexual activities until both of you are done with the treatment and are certified that the infection has gone. And then you do the measures, like I said earlier, that will help you. And drink lots of water. It helps flush your system. And for women, you have to stop gouching, okay? Watch the video on how to care for your vagina, how to wash your vagina and your vulva. This will really help you in preventing recurrent infection and also recurrent cyst and urinary tract infections, okay? So drink water, work out, eat healthy food, eat lots of fiber, vegetables, reduce carbohydrates intake, reduce sugar intake, and work out. Okay, so that is all about it. Let me know if you have more questions. Like this video and subscribe to my